Welcome to The Explainer. Today, we're diving into a report that, well, it completely rocked the medical world. It pulled back the curtain on a hidden and honestly, a pretty terrifying crisis happening right inside our hospitals.
Now these stories, they're not just some made-up examples. These were real people, real tragedies that grabbed headlines. But what this report showed was that these horrifying cases, they were just the tip of a massive, and I mean massive, iceberg.
And this is the number that just stopped everyone in their tracks. The report estimated that as many as 98,000 Americans were dying in hospitals every single year, not from the diseases that brought them there, but from preventable mistakes.
Okay, so to really let that number sink in, just look at this comparison. We're talking more deaths from medical errors than from car crashes, more than breast cancer, even more than AIDS at the time. It was a silent epidemic, making it one of the leading causes of death in the US. Just unbelievable.
And it's not just the tragic loss of life. The financial cost was just staggering. We're talking up to $29 billion a year. That's money lost from people not being able to work, disability payments, and all the extra healthcare needed to try and fix the original mistake. A huge, huge cost.
So all these shocking numbers led to one big urgent question. How on earth was this happening? In what we thought was the best healthcare system in the world? Well, to figure that out, we're going to break down the report's investigation. Here's what we'll cover.
All right, first things first. When you're tackling a problem this massive, you've got to be clear about what you're even talking about. So the report's authors started by laying out some really clear definitions.
So what exactly is an error? The report defines it in a really simple but powerful way. It's not about doctors having bad intentions. Not at all. It's about a breakdown in the plan. It can happen in two ways, really. Either you have the right plan, but you mess up doing it. That's an execution error. Or you have the wrong plan to begin with, even if you execute it perfectly.
Okay, and here's a super important distinction. They talk about an adverse event. That's basically any injury you get from medical treatment, not from your actual illness. But, and this is key, not all of them are preventable. A patient might have a bad reaction to a drug that no one could have predicted. That's an adverse event, but it's not an error. The report zeroes in on the ones that are preventable, the injuries that shouldn't have happened.
So the big question is, if these mistakes are happening all the time, who's to blame? Or maybe, what's to blame? And that question right there leads us to what is probably the most radical, game-changing conclusion of the entire report.
For ever, the way medicine dealt with mistakes was to play the blame game. You'd find the so-called bad apple, that one doctor or nurse who messed up, and you'd blame them, maybe fire them. But this report just turned that whole idea on its head. It said, hold on, the problem isn't bad people. The problem is bad systems. Systems that are practically designed to make good, caring people fail. And that really gets to the core message of the whole thing. To err is human. I mean, we all know that, right? People make mistakes. It's what we do. The real failure wasn't that doctors and nurses are human. It was that the healthcare system was built as if they weren't. You can't make people perfect, but you can and you absolutely must build better systems that catch those mistakes before they cause harm.
So if the answer is build better systems, the next logical question is, how? Well, to figure that out, the report's authors looked at a totally different industry, but one where mistakes are also a matter of life and death: aviation. Yeah, just think about how airplanes work. We don't just trust pilots to be more careful. No way. The entire industry is built around safety systems. They've got checklists for everything, standardized ways pilots have to talk to each other, strict rules about how much rest they get. It's all designed to make it easy to do things right and really, really hard to mess up. And what the report found was that healthcare was frankly decades behind this way of thinking.
Okay, so now we have the diagnosis, right? The problem is the system, not the people. And we have a model for what a good system looks like, thanks to aviation. So the next step was for the report to lay out an actual plan, a real, actionable blueprint to fix things.
And their solution was this really comprehensive four-part plan. The whole idea was to embed safety into every single layer of the healthcare system. We're talking from the very top at the national level, all the way down to what happens in a single doctor's office or hospital room.
So kicking things off at the very top, the report called for a brand new National Center for Patient Safety. Think of it like a central command post for this whole mission. Their job would be to set the big safety goals for the entire country, keep track of how we're doing, and make sure everyone has access to the latest research and best practices. All right, next up, reporting errors. This was a really clever two-part strategy. First, you need a mandatory public reporting system for when something goes terribly wrong, when a patient is seriously harmed or dies. That's for public accountability. But you also need a second, confidential system where doctors and nurses can report smaller mistakes or even near misses without fear of punishment. Why? Because that's how you spot weaknesses in the system before they lead to a disaster.
And at the end of the day, all of these big top-down changes, the National Center, the reporting rules, the new standards, they were all pointing to one thing. They were all designed to force change where it truly counts, on the ground, inside the hospitals and clinics where we all get our care. What this really meant was that patient safety couldn't be an afterthought anymore. It couldn't just be a nice-sounding slogan on a poster in the hallway. The report was clear. It had to become a serious, visible, #1 priority for every single person in leadership, from the CEO on down.
And how do you make safety a priority? Well, by actually designing for it. This means doing things that are proven to work, like standardizing processes and even equipment so there's less confusion. It means creating that culture of trust where people feel safe reporting errors without getting blamed. And it means training doctors, nurses, pharmacists, everyone to work together as a cohesive team.
So this incredible report, To Err Is Human, came out way back in 1999, and it ended with this one simple, powerful question. Now think about that. More than 20 years have passed, and you have to ask yourself, is that question any less urgent today? I'd say it's more important than ever, and it's a question that every single one of us, as patients, needs to keep asking, because our lives might just depend on the answer.